Hello and welcome. My name is Diane and I'm here to be your facilitator today. And we are here to discuss the case of Mr. Bennett. Mr. Bennett is an 81-year-old that was admitted to the hospital yesterday, and our job is to come up with a discharge plan. So let me tell you a little bit about Mr. Bennett. So he had driven his car into a garage yesterday morning and was found at home by his nurse during a routine case management home visit following a previous myocardial infarction. He was experiencing right wrist pain and appeared confused at the time of the accident. The nurse called EMS, who transported the patient to the hospital. In the emergency department, they determined that it was just a sprain of his right wrist where they splinted it, and also raised concerns about his ability to care for himself at home due to that dominant arm injury. The family noted that he had been struggling to care for himself over the past few months and seems withdrawn, and he was admitted under observation and for further testing. So you have each had a chance to gather information about Mr. Bennett in the huddle, and this is the time for you to share your information and come up with a collaborative plan. So the first thing I want you to do is to know who's at the table, so I'm going to ask you to introduce yourselves to one another, and we'll start with Sam.
I'm Sam, and I'm the social worker.
I'm Olivia, and I'm the dietitian.
I'm Serena, and I'm the speech-language pathologist.
I'm Patrick, I'm the pharmacist.
I'm Nancy, and I'm the nurse.
I'm Sue, I'm the physician.
Okay, great. So now I would like to turn the meeting over to you. I will not be leading the discussion, but rather I would like to see you take leadership along the way, and I want you to be able to share your perspective with everyone else so that we can come up with that collaborative plan. Try to remember to use your Team Steps tools that we've taught you, and remember to take the notes that other professions who are not present into consideration when you're making your plan. So the daughter of Mr. Bennett will be joining us in about 10 to 15 minutes. So this is your chance as the healthcare team to come up with your plan in advance so that you can share it with them. So who would like to begin with their profession-specific problems?
I can start with the details I know. I've only met Mr. Bennett once, but I can tell you his wrist is only sprained, so there's no need for further medical intervention. A split end rest is all that he really needs. I have spoken to him though, and I find him cognitively intact. With just a sprain, why don't we just send him home from the ER?
I am concerned about him going home. The family reports he has declined significantly in caring for himself. My top concerns are his uncontrolled diabetes, his cognition, mood, and also his pain control. Let's start with diabetes, and I can take notes so that we can keep organized.
I guess now that you mention it, his diabetes is out of control. His A1C is elevated. We'll have to follow up on that and make sure it gets better.
Yeah, after I spoke with him, he told me he eats out a lot, and he doesn't follow a diabetic diet. His wife did all the cooking, so he has no interest in cooking. We could find someone to bring him in meals or get him set up with something that can allow him to get regular meals.
I completed a bedside swallow exam, and I found that he had a normal swallowing pattern with mild slowing in the oral phase. I recommend to just continue a full oral menu.
Well, that's awesome. I want to do diet counseling with him then and talk to him about carb counting. Between meals, we could also recommend supplements. The ones that are lower in sugar include Carnation Instant Breakfast. That's the cheapest option, and that has 150 calories, 17 grams of carbs, and 13 grams of protein. Ensure Light, which has 80 calories, 3 grams of carbs, and 12 grams of protein. We can just talk to him and see which one he would prefer.
Looking at his finances, Meals on Wheels is definitely an option as well. Also looking at communal dining, he was really involved with his church and maybe reaching back out to them to see if there's any meals that way that could be provided, and which serves also as social interaction, important because he tested positive on this depression screening.
Yeah, I'm going to hold you just for a moment on that depression idea. We can come back to that, but I feel like we should tackle all of the diabetes perspective first.
Right, I can work with dietary to keep his blood sugars in check and also educate him on diabetes so that he can better control his blood sugar levels.
And in addition to that, I'm also concerned about his medications. Looking through the list, I can see that he's currently taking empagliflozin for his diabetes. And looking at the lab results from the hospital, they're treating him for a UTI. He was tested positive for a UTI. Empagliflozin has a side effect of causing UTI in elderly patients. And also in his case, his diabetes isn't controlled at all. His blood sugar is way too high. So I don't think it's even working for him in his case. So I recommend we discontinue the empagliflozin and start him on metformin, 500 milligrams twice a day.
Yeah, so we did start an antibiotic for that UTI, and I agree that changing that medication for the diabetes makes a lot of sense.
And in addition to the UTI, I also saw that he's taking Benadryl at home. These two are major risk factors for cognitive deficits, delirium, and I feel like that's something that needs to be addressed.
So are we all okay with the plan on his diabetes control? And since you mentioned Benadryl, can we start with his cognition?
Yeah.
So I completed a cognitive examination, and I found that upon admission, he was disoriented. He had inappropriate behavior, such as trying to get out of bed. And as of this morning, there was no evidence of delirium. Could this be caused from the discontinuation of the Benadryl?
Yes, because the last time he took his Benadryl was the night before the accident. And while he's been here, he hasn't had any Benadryl. We didn't give him any Benadryl. And I'm assuming he's been normal for the most part. So with the way Benadryl works, one of the major side effects is it causes cognitive decline and delirium. So I'd recommend stopping that immediately, and we can bring that up during education as well, tell him to stop taking that. And I recommend melatonin at 3 milligrams to help him with his sleep. And during the education, we also go over his sleep habits, sleep hygiene, things like that.
That's good, but I'm starting to wonder if his sleep troubles are related to depression. When I was assessing him, he did test positive for it. Is everybody good on delirium? So now we can discuss on depression, and I noticed that he is not also taking medications for depression.
I'll share some of the history after my discussion with Mr. Bennett. He lives alone in a 2-story home. His wife died from lung cancer, and since her death, he has not been sleeping very well. They were married for 62 years and had 2 children. Their youngest son died 3 years ago in an accident. Mr. Bennett had retired after 30 years with Goodyear, and Mrs. Bennett took pride in being a homemaker. She did all of the cooking and cleaning and caring for her family. They were also very active in their church. It was a Catholic church, but he has not attended since her death. So right now, his best friend is his dog, his golden retriever named Mickey. His daughter did take time away from work and her family to take care of Mrs. Bennett while she was sick, and she has been struggling to catch up since then. So she's very overwhelmed by the entire situation and isn't really sure what the next steps are. With all of this, I think Mr. Bennett could definitely benefit from some grief counseling.
Okay, hold on. I think we're getting off track here. He came in for a sprained wrist, and now we're talking about grief counseling.
I think it's important as a team for all of us to focus on Mr. Bennett as a whole person and not just the wrist.
I agree. I think his depression is affecting all of his health, especially nutrition. He's been losing a lot of weight recently, and he hasn't had an appetite.
And in addition to that, looking at all this together, I'd also recommend duloxetine, 30 milligrams, because this would not only help him with his depression, but also help him with his anxiety, which is why he was taking a Benadryl in the first place to help him sleep, and also for pain, because he is dealing with pain as well.
Yeah, those are really good points. Yeah, we do need to address this issue.
I'm glad that we finally got depression addressed. I would like to now talk about his pain. This morning he said he had an 8 out of 10, and I just am wondering, what are we going to send him home with to control his pain?
Short-term opioids an option. Just 2 points about his pain medications. First, I want to take him off of the one he's taking right now, naproxen, and then Nancy, later we could also educate him on why he can't take NSAIDs, just because of his prior history of a heart attack. And so I'm recommending we stop that. And before we can do with the opioids, I recommend we start him off with Tylenol, acetaminophen first, at 1,000 milligrams every 8 hours. And then the opioid we can add on later in addition to Senna. The reason why I want to start with the Tylenol first is because we're going to do a scheduled Tylenol, because this has been proven to be effective. And then the opioid we can add on later if he needs additional help.
Looking at the physical therapist notes, they recommend strength training for his wrist. This can be done at home because his insurance doesn't pay for inpatient physical therapy rehab.
Okay, great. It sounds like you came up with a wonderful, comprehensive plan, and now I think it's time to bring the daughter in and bring her into the discussion and find out what she can bring to us.
Thank you for joining us, Mrs. Bennett. Before we get started, we're all going to introduce ourselves. I'm Sam, I'm the social worker.
I'm Olivia, and I'm the dietitian.
I'm Serena, and I'm the speech language pathologist.
I'm Patrick, I'm the pharmacist.
And I'm Nancy, I'm the nurse.
I'm Sue, I'm the physician.
I'm here just to facilitate the discussion.
Should I start? I just don't know where to start. I'm really flustered right now. My father is getting ready to be released, and he is not ready to come home. He had this accident the other night, and he didn't even know how it even happened. He's confused. I think he has dementia, and he should be placed into a nursing home. He can't go back to his home.
Ma'am, based on what we looked over with your father's history, his condition, and his medications, we feel like he doesn't have dementia. And Serena can elaborate further.
Yes, I agree with Patrick. As a part of speech therapy, we do cognitive evaluations, and they're pretty in-depth. So upon admission, we found that your father was disoriented, but as of this morning, we found that there was no evidence of delirium. And based on our assessments, we found that there was no evidence of dementia, which this could also be caused by the discontinuation of the Benadryl. Would you agree?
I agree. And in addition to that, when I talked to your dad, he said the last time he had taken Benadryl was the night before the accident. And all the time while he's been here, we haven't given him any Benadryl. And so he hasn't shown any symptoms of delirium. And in addition, when we did admit him and we ran a lab test of his urine, we found that he had a UTI, a urinary tract infection. So those two, the Benadryl and the UTI, are major risk factors for causing the delirium, the disorientation, and the confusion. So we feel like those two risk factors are the main reason why he felt confused, why he felt disoriented during the accident.
And we are currently treating his UTI, and we're also going to provide education about the effects of what Benadryl can do as far as cognition goes.
All right. And to help your dad with his sleeping problem, I'm going to recommend melatonin, 3 milligrams, as needed at night, because this one should help him stay asleep longer, and it shouldn't have that delirium effect like Benadryl does.
And some things that speech therapy can do for your family is we can provide some strategies at home that might be able to help with medication management and blood sugar checks and things like that. We can set reminders and have checklists.
So the confusion, the forgetfulness, you're saying is all coming through the medicines that he's taken?
We think Benadryl plays a huge part, in addition to him having a UTI as well.
So if we send him home, though, that medicine is still in his system. Wouldn't he still be confused?
At this point, the Benadryl is going to be out of his system. And when Nancy and I work up the education plan,
Yes.
we're going to tell your dad we don't think he should be taking Benadryl anymore. And we're going to replace a sleep aid with melatonin. And in addition, we also want to go over his sleeping habits as well.
Yes, and see, that's another problem about not sending him home. He can't sleep. Sometimes he says it's hours before he can get to sleep. And then he doesn't have any desire to do anything anymore. He used to take care of the yard when my mom was living, and now he doesn't do that. He used to eat dinner with us on Sundays, and for the last 3 months, nothing. He's just different. He has no friends. He just sit, and I just don't think he should go home. There's something wrong there, and it's not just the confusion. It's that with. Excuse me, but it's that with everything. He used to go to church, and he was an usher, and he hasn't been there. And I know that was because of my mother, but still, now he's lost his friends. There's just so much. The sleeping, he's not eating. For God's sake, I went to his house today and I took those car keys, but I noticed that the house was just a wreck. He has a golden retriever, his best friend Mickey, and hair was in the corners, and it looked like the floors hadn't been vacuumed and the bathrooms were dirty. He cannot live alone. And I just feel so guilty because I can't take him in. I can't do that, and things are not good.
And you are correct about all those additional symptoms, not just the disorientation and the confusion of how your dad's just been not as motivated and just kind of shut himself off socially. We feel like that he's also suffering from depression. Nancy can elaborate on that.
Of course, I did assess him and found that he was positive for depression. And looking at his meds, I noticed he is not on an antidepressant.
And I also did a screening for depression and found it positive. And I did a visit with your father in the home, and everything that you've mentioned so far is absolutely correct. Those signs of the clutter, everything, those are issues that are important, but I do think it has to do with the depression.
And his depression also will affect his appetite, and we do believe that is why he's been losing weight and not eating as much.
And one of the things that I've suggested is grief counseling, if that's a possibility.
We tried that when my mother passed, and he just doesn't want to have anything to do with that. He wouldn't go.
Okay.
Okay. In that case, I can recommend an antidepressant, duloxetine. This one will be at like 30 milligrams once a day. The reason why this one I feel like would work best for your dad's case is not only because of the symptoms of depression, the motivation, the kind of like just shutting himself off, but also the anxiety that's keeping him up at night. And also I saw that your dad reports that he's dealing with pain as well. Duloxetine can help with all three of those issues. So that would be my recommendation if we were to start an antidepressant.
Now that you brought up the pain, he's in a lot of pain. His pain he told me, is almost unbearable. How are we going to get him to take his medication? And what about you put him on narcotics? I don't want him to get hooked on narcotics or take them improperly and something happen. I don't know what to do with that.
First is I'm gonna recommend we stop the naproxen. That's what he's taking right now. And Nancy will go more in depth with your dad about that, but we just feel like with his history of having a heart attack and also with his heart medications, the naproxen, the NSAIDs are just gonna really interact with that, really gonna make things worse. So that's the first thing we're gonna take away. And to deal with the pain management, we wanna start him on Tylenol. This is gonna be scheduled Tylenol. It's gonna be different than just taking it over the counter, but this scheduled Tylenol is gonna be 1,000 milligrams every 8 hours. The opioid portion, the oxycodone, we're gonna hold it and we're gonna keep it as an option until we see how he's able to handle the Tylenol, because the Tylenol should work if he's able to maintain the schedule. And Nancy will elaborate more on helping your dad stay with his medications.
Absolutely. We'll work with him. We'll discuss how the medications work and things to watch out for. And also there's other ways to manage pain besides medicine.
Also, the physical therapist said that they want to do exercise with him to work with his wrist, and they will do rehab in the home with him for that.
I understand what you're saying, and we can try it, but I am still so concerned about him going home. He fell. There's just so much. I don't think he should be at home alone.
And we went and did a home visit, and we did find a few safety hazards. That clutter that you were talking about
Yes.
earlier, for sure, is a safety hazard. Also, his railing. He lives in a 2-story home, and his laundry is in the basement, I believe.
Yes.
And there's only a railing on one side. And I know there was some poor lighting upstairs. So those are some modifications that we may be able to make that home safer.
In addition to that, looking over his medications, I feel like by recommending to him that we stop the Benadryl, because Benadryl made him disoriented, it made him confused, we can reduce like his risk of falling as well just by taking him off the Benadryl.
Optimizing his home environment is really what we have to do, because the physical therapist said that his insurance will not cover him to go into a nursing home.
Yeah, so if we wanted to put him in a nursing home, it would have to come out of pocket, and I'm not sure that his finances are capable of covering that. However, he does have good insurance through Goodyear, and he's financially stable enough that we could definitely get him some in-home health aids to do some like cleaning and cooking, and we could make some modifications, putting in grab bars, moving the laundry, things like that.
Well, he's not going to go for anyone coming into the home to clean, but can they help set up his medicines?
Yeah, we can actually set up something with pharmacy. They can pre-package all of his medications for him and make sure that he complies with it.
Along with like managing his medicine, I think it would be helpful for him to do diet education class to help him manage his diabetes, because there are diabetes education classes and different things like that.
And speech therapy can help with the medication management. We can help set reminders and things like that.
And in addition to these changes, I'm also recommending we change his diabetes medication just for 2 reasons. One, the empagliflozin, the way it works is it's pushing out sugar into his urine, so we believe that is what may have caused him to get a UTI in the first place. And secondly, looking at his blood sugar, it looks like it doesn't even work for him because his blood sugar is above a 7 and it's at 8.4 right now. So we don't think it's even helping him in this case. So we wanted to change it to a metformin twice a day, 500 milligram twice a day. And it's usually our first line treatment too.
And don't worry about having to memorize all this. We have all these instructions written down for you.
Thank you.
All right, great, Nancy. It seems like we're out of time now, so why don't you go ahead and summarize everything for her just so she knows what the plan is in place for right now.
All right, so the first thing we're gonna plan for him is for his cognitive struggles, we feel that we should discontinue the Benadryl and treat the UTI, and his delirium over time will go away. And speech therapy will also work with memory cognitive strategies, and pharmacy can help with medication packets and organization systems. The second thing, for his self-care problems, we will consult home health aides to help organize the home, assess where supportive devices can be placed for safety, and consult with OT for adaptive strategies. And then as far as his pain is concerned, we will have him on a medication regimen and have PT there with him. For his diabetic control, we will do diet counseling and seek out meal delivery options from the church or Meals on Wheels. And the last thing I want to point out is for his grief and depression, we will consult with the church and counseling if he is willing to do that, and start a new medication, which will be the antidepressant.
Okay, let's try that.
Okay, great. So now I'm going to call the end of the simulation. So we're all done discussing Mr. Bennett. And what I want to do next is transition into a debriefing. And during our debriefing, I'm just going to go through some different things that happened during the discussion and have you take over and reflect on how things went, how you think things could get better, or what you even did well. And just remember, we're all here to learn to get better at what we do, and that our patients will benefit in the end. So it's okay to criticize each other, but we're going to use it constructively in order to get better in the future. Okay.